Welcome to the Dr. Jim Cares podcast with Dr. James Augustine, where we provide powerful solutions for helping you create wellness. The following discussion is for educational purposes only and is not meant to diagnose or treat disease. Because our approach is individualized, it's important to not apply this information without first consulting with your healthcare professional. And now, here's Dr. Jim.
Hi, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today we're going to be talking about something called Biocranial. Phenomenal stuff. Is your health all in your head? It's kind of a thing that I like to say. Your health is all in your head. It actually is, and let me tell you why. Some thoughts and questions here. How healthy are you? How do you know? Do you rely on what doctors tell you, which is typically your blood work is all clear, so you're looking good? And classically, that statement frustrates people incredibly. They only test for disease, as you might know that. So doctors, of course, just blame everything, and maybe you've heard this as well. Doctors blame everything on your age and, well, you're just getting older and it's genetic. Both of those issues, of course, you can do nothing about those issues. So who is the real doctor? Truly, who is the real doctor for you? So today we're going to cover all of that. We're going to talk about, in my practice, some difficulties that I've had. We're going to talk about the chiropractic premise. We're going to talk about the journey into what's called biocranial, and actually how we can really get results that I've never gotten before prior to biocranial, and also why we get such good results that no one else gets today. So let's talk about this. Early on in practice, the premise, the foundation, philosophical basis of why I do what I do, chiropractic basis, is that your body is self-healing and self-maintaining. All healing comes from inside out. And when you have health problems, we're seeing it from a chiropractic perspective, is that the supremacy of the nervous system. Your nervous system, if there's interference to it, then things are going to go wrong in your body. So if we can find and remove that interference, then you should heal. Well, being quite a few years in practice and not seeing that happen, I was getting frustrated. Until one day, I discovered a technology that I love about this technology. It's called Heart Rate Variability. It's an EKG-based test. It shows heart function. More importantly, it shows your autonomic nervous system. It's the automatic side of your brain that runs and regulates your organ systems and your body without you having to think about it. It's the automatic side. Had this technology for 6 years before I could change the results of that. And that was the frustrating side, 6 years. And then I was reading in a journal, it said that if 80% of the nervous system is above the spine, what are you doing about that, doctor? And I thought, wow, this must be it. So I took my technology, my testing with me to a preview of what was called Biocranial. And I said to them, if you can change the results of this exam, I will do your work. I will do and get certified in Biocranial. Sure enough, it was the only thing that actually does shift and improve the autonomic nervous system that I discovered, because I tried every way of adjusting patients. Upper cervical, C2, lower cervical, sacrum, full spine adjusting, nothing would shift this exam, because one part of this heart rate variability testing is a real-time test where you can have somebody lay there, turn it on and record 192 beats, pause it, and you can graphically see heart function, but you can also see the sympathetic and also the parasympathetic. Sympathetic is the stress side of your nervous system, also known as the fight or flight side. And then the rest and digest side, the parasympathetic. You can see where they're at. Then you turn it back on as you make any kind of intervention, and you can see if that makes an impact. That was the frustrating part. I could not do that, could not get any kind of change with all types of adjusting until I discovered Biocranial. Now, a little bit of a history. Biocranial was discovered by a Dr. Robert Boyd in the late 70s and early 80s. He developed this. And phenomenal. This doctor, he was an osteopath, but he was a cranial osteopath. And again, in his search for really what's going to make the biggest shift and improvement in a person's health and wellness, he came up with and discovered this thing called biocranial. I was amazed. My first biocranial correction, they call it, was profound. First off, during the biocranial, and imagine you're laying on your back, flat on a table, and there's a very specific contact made on the back of your skull. And let me show you. This has been a good friend of mine, this guy right here. He completely comes all apart. This wasn't a patient of mine, by the way, just to let you know. This is a skull, an articulated skull, and during a biocranial, there's a very specific spot on the back of the skull that we need to make a contact with. And we bring the head up and around, kind of in an arc position, and it's a very deep stretch to a muscle that attaches to the base of the skull. And in so doing, what happens is there is a shifting of this joint that's formed between the occiput here and your sphenoid right in front of it. That's right there, you can see that on the video. It's called the sphenobasilar joint. That joint shifts vertically and it creates global expansion of all 22 skull bones and hence improves brain function. Pretty amazing process. My first biocranial was profound in the sense that my visual acuity got really sharp, my mental acuity as well. And it's because the visual acuity was your visual cortex is in your occiput back here, plus the sphenoid bone, this red that's going through the side here. This, in the center of that is your pituitary gland, so it also affects your hormones in a great way. Plus right in front of that is your optic nerve, so therefore it can affect your vision. So my visual acuity, mental function got really crisp and sharp. My sleep was amazing. I would wake up full of energy. Light felt amazing for like 5 days straight, just with my first biocranial. So not only did I feel a difference with biocranial, it objectively was shown that it improves a person's autonomic nervous system. And if that's true, which it is, 80% of the nervous system is above the spine. No wonder I wasn't seeing people heal from any kind of illness or disease process. That's been my journey, and it's been phenomenal ever since. This was the big shift and turning point into holistic healthcare, truly to get the results that we wanted to get. Because as a result of my mom passing away because of chronic illness and cancer, I tended to attract all of these chronic illness patients. All types of cancers I've seen, glioblastoma brain cancer, many cases of that. We've solved pancreatic cancer, not me, but the patient actually healed because I was focused on what was interfering with their ability to be healthy. Because I never treat or cure anything. It's always a person is the real doctor for their body. And guess why? It's the autonomic nervous system. So in doing thousands, probably tens of thousands of scans on patients, chronically ill patients, terrible nervous system, terrible autonomic nervous system function. People with great health, great nervous system function. So we could then take these people and improve their autonomic nervous systems. They can actually heal. So never treat disease, always try to find out why their body can't heal, why it's stuck, and remove that interference, and their body can actually do the job that it was meant to do. So some conditions that I've seen just from biocranial, this was back in the day when we only did biocranial with patients. A gentleman, older gentleman, who had a cerebrospinal fluid shunt in his brain that had gone south, it stopped functioning. So he had tremendous CSF, cerebrospinal fluid pressure, tremendous pressure in his brain. So he was vomiting probably 10 times a day, every day, just because of that pressure buildup. We strapped him into heart rate variability. We looked and watched and observed as I did his left side. We do both sides, by the way, because you have a left and right hemisphere in the brain. And we found that one side, like his left side, as we started to do that, he started to heave a little bit. So we said, okay. And again, his nervous system, it moved and improved a bit. But then we did the other side and we got lots more improvement with no nausea or no heaving. So we just stayed on his right side. And we did that. We did biocranial on him probably twice a week for the first month. Literally within a month's time, he was vomiting maybe once every couple of days, and then pretty soon it was once a month. So tremendously shifted that and balanced the pressure, his cerebrospinal fluid pressure, just by doing biocranial. We had a child, 15, 16-year-old who had tremendous asthma. So much so that his mom sought me out because they wanted to add in steroids into his regime of what he was taking. Steroids, of course, are really heavy-duty, massive anti-inflammatory medication, and I really understand why a doctor would do that when that's your only tools to use. So during the process when we started with this boy, the boy said that after his first biocranial that we ever did with him, he never had any asthma attacks whatsoever again. He got off all of his medication by himself, and this was, of course, admitted to me and his mom, probably a month after we started his care, because we're just checking in, seeing how he's doing. And he said he never had any asthma attacks ever since I did the first biocranial. And he also, on his own, stopped his medication. So his mom was pretty upset with that. But anyway, and he's still good to this day. No more asthma, just with that first biocranial correction that we did with him. So it's been a profound thing. I've seen traumatic brain injury. Also, we do this with everyone, including, doesn't really matter what comes in my office. If we can do biocranial and jumpstart and improve brain function, people then are able to heal. They begin healing. We then like to say that the tools and fuels to do the job, so we're giving the brain, central nervous system, the tools and fuels to then fix the body, which would be nutrients, things of that sort. And people actually do some tremendous healing. It's been really, really rewarding to see the kind of healing that we've had with patients from all over the place. It can be anything from headaches to hormonal imbalances to massive stress and fatigue to autoimmune problems, cancers. And again, we don't treat, cure, or heal anything. It's always done by the body. Always done by the body. So biocranial, phenomenal piece and phenomenal tool that we use to get people to heal. And guess what? Anybody that comes in my office gets biocranial. And you might say, or people have said, well, gosh, you do the same thing on everybody. And I said, well, yeah, it's because everybody has a brain. And that's really where healing comes from. And we do both sides because you have two hemispheres in your brain. Kind of an important process. So biocranial is phenomenal. That's it. If you have any questions or comments about this or about conditions that you may be experiencing, I'd love to help you out. You can email me at draugustine@gmail.com, or you can reach out to my office, which is at a phone number called, the phone number is 562-860-3404. I'm also on social media. I'm on Instagram, TikTok, as well as YouTube. So please give me a follow there. I'm also, though, on podcast. Apple, Spotify, Google Podcasts, anywhere there's podcasts, this is being put on all of those. So please subscribe and give me a like there as well. Again, my name is Dr. Augustine from Head to Wellness. Thanks so much for watching and have a great day.
Thanks for joining us on your journey to wellness. Join us next time for more information and education about your health. And feel free to contact Dr. Jim on social media or at his office, Head to Wellness in Buena Park, California.